Have you ever been told that your thyroid labs are normal, but yet you still feel really tired, exhausted, bloated, or just not like yourself? Because we see this all the time. And today we're diving into what might be going on below the surface, especially when it comes to thyroid and autoimmunity. Hi everyone, my name is Zen Tuan. I'm a licensed acupuncturist, herbalist, and founder of Healing with Zen. And today I'm here with Dr. Kiara, who specializes in autoimmune. So I'm really excited to jump in and talk more about this thyroid issue.
Great, yes. I'm so excited to talk about this. So I wanted to focus on Hashimoto's and hypothyroidism for this one, and then we can maybe do hyper too if people want that, but today we're just going to be focusing on hypothyroidism.
Great. So Dr. Kiara, for someone who's new to this topic, what are the main thyroid conditions that you typically see or treat?
So we do treat hypothyroidism, hyperthyroidism, and then the autoimmune presentations of both of those. So Graves and Hashimoto's, and then also goiter. So some people might just have an enlarged thyroid gland and maybe nothing else is quote unquote wrong with them, or their labs are normal, but they do have that goiter. So we see that as well.
I feel like a lot of times people don't realize they have a thyroid issue to begin with. Mm-hmm. What are some common signs and symptoms that they should look for?
Yeah, that's a good question. A lot of them are non-specific, so it is kind of like piecing them all together. So we have fatigue, weight gain, feeling cold is a big one. Not just hands and feet, but kind of like your whole body feels cold and you feel like you have poor circulation, dry skin, dry hair, dry eyes, sluggish digestion is also a really big one. Changes in bowel movements, usually it's constipation with Hashimoto's or hypothyroidism, but it can be either or. Also heartburn and bloating. Sometimes the stomach acid is actually not as high as we would want it in Hashimoto's or hypothyroidism. And then also like stomach pains, gassiness. There's a whole slew of symptoms, many.
And do you usually think that there's one symptom can be a telltale sign, or a lot of symptoms usually are a key way to figure out that you have a thyroid issue?
Yeah, usually I would say if you just have one, like if you're just tired all the time, it's not meant to, you shouldn't be freaking out that you might have a hypothyroid condition, but it really is piecing together all the little signs and symptoms that can mean a lot of things, but when you put them together, kind of highlight the hypothyroidism picture. So the ones that I just mentioned tend to be the most common that I see with patients here.
Okay, that's really fascinating. Can you tell us the difference between T4 and T3 in a simple way, because I know these are markers that they're testing for when you do have thyroid issues?
Yeah, for sure. So definitely make sure, we'll get into this a little bit later, but make sure that you're doing a full thyroid panel, because sometimes they'll pull out certain markers and it's kind of hard to know without seeing the whole picture. So we'll talk about that. Yes, there are two main thyroid hormones. One of them is T4, one of them is T3. T4 must be converted to T3 in order to be active. So your body actually makes mostly T4, between like 80 and 90% T4. And then different parts of your body have to convert that for it to be active and for it to work. So that's kind of where the trickiness lies, because if you have any sort of inconsistencies or issues with those organs, such as liver, kidneys, intestines, muscles, your brain even, then you can have trouble converting into that active T3, and then that brings on some symptoms of hypothyroidism. So look to liver, kidneys, intestines, and muscles mostly. That's where you're going to activate the T4 into T3 so that it's usable.
Okay. Let's talk a little bit about stress, because I think stress can also play a huge component when it comes to autoimmune and thyroid issues. How does cortisol actually affect the thyroid?
Yeah, overall, we know that stress is probably the key starter of all major issues in the body. It really, really does a whole number of things that it's hard to talk about all in one podcast. But an easy way to think about it is that cortisol can actually turn T3, which is the active thyroid hormone in your body, into reverse T3. And you don't want that because you can't use the reverse T3. Your body can't use it, so it's not active to it. So it basically slows down your metabolism over time.
What does reverse T3 actually do?
So it's just an inactive T3, so it just doesn't do anything.
So you're saying that the stress hormone will take something that's active and make it inactive so that it doesn't function as well.
Slowing down the metabolism, yes.
So it's really important that we manage this stress response in the body, right?
Definitely.
People don't realize all the time that stress can contribute to so many different things.
Definitely, yeah.
And then there's estrogen, which I feel like comes up a lot in our patients. How does that tie into thyroid health?
Yeah, so we'll talk a little bit more about estrogen a little bit later when I have a few tips for Hashimoto's and hypothyroidism. But in short, estrogen does increase thyroid binding globulin. Basically, it just takes it out of the bloodstream for it to be used properly. Again, kind of like cortisol, it basically just kind of shuts that process off where your body has a lot of T3 that it can use for its metabolism. Estrogen and cortisol both have a pretty severe effect on the amount that's usable for the body.
So is it safe to say that if you are to have hormonal changes or fluctuations, it can affect the thyroid function too?
Yeah, for sure.
And would you say that during transitional times in a woman's life or a man's life, if hormones are shifting, that they're more prone to getting thyroid issues?
Yeah, that's common, especially, and we'll talk about this too, but around menopause, you're not necessarily in estrogen dominance around that time, but your progesterone starts to get weird and probably low. So you're in a technically estrogen dominant state. So yeah, it can happen around then, and also around like
Pregnancy.
Is a big
it's a
one.
huge shift in hormones.
Yes.
And I wonder too, what about with teenagers when they get their periods?
Yeah.
Because sometimes people are diagnosed with thyroid early on in high school when that happens
Right around
too.
that time period. Yeah, for sure.
Okay, let's talk about these tips then. Let's start with nutrition or nutrients. What are the most important ones for thyroid function?
Yes. So there are basically, when you're talking about any sort of autoimmune condition, you definitely want to make sure that you're eating a whole foods diet. Try to get as organic as possible. I know it's expensive, but if you can do it, try. And make sure that you're optimizing your digestive function. But with Hashimoto's or hypothyroidism, there is a few nutrients that are pretty key and crucial to pay attention to. So we have zinc, we have selenium, we have magnesium, we have iron, and then iodine also, which we'll talk about a little bit more. And then on top of that, you have glutathione, or really any antioxidant, but glutathione mainly because it helps with liver detox, and then all the B vitamins. So those are crucial to be in not just like normal value, but optimal value. So like functional levels of those nutrients.
And are these things that a normal doctor would be testing?
Maybe.
Probably not, right? I feel like
Yeah.
a lot of this is tested outside of the regular CBC
Panel, yeah.
panel.
Yeah.
So it's important, if you do think you have thyroid issues, to maybe ask your doctor for testing these type of markers.
Yeah,
right?
definitely.
Or find a maybe functional medicine doctor that can do that for you. So too much iodine, I've also heard, can flare up thyroid issues too. So how do you
Yeah.
figure out what's the proper amount?
So there are a couple tests that you can do for testing iodine. Some of them are within a thyroid panel, so some doctors will put that into that test just to make sure that you are at the optimal level. You can also do an iodine loading test, so that's testing it over 24 hours, and that way you know if you're getting rid of it well enough, or if you're holding on to too much of it. But yeah, there are cases where high iodine will actually flare up a Hashimoto's patient, and it actually causes like an autoimmune flare, basically. So iodine is one of the ones that you kind of want to be a little bit more careful with.
So you mentioned the autoimmune flare. What would that look like for a patient? How would they know if they're having a flare-up?
Yeah, so in Hashimoto's, it would be all of those symptoms that we said. You probably would feel them a little bit more,
Exacerbated.
almost like a flu or like a hangover, like that sort of feeling. And you haven't changed anything else. So it's like kind of confusing why you suddenly feel much worse.
And then you said Hashimoto's. So let's talk about Hashimoto's because we're seeing this term used a lot more. What does that mean, Hashimoto's?
Yeah, so Hashimoto's is when the thyroid itself is being what, they say attacked by the body. So basically the cells that are trying to produce the hormones are now being taken away by the body. The body is on edge for whatever reason, and it's related to the thyroid. So your thyroid ends up not being able to output enough of the hormone, and so you get all of those hypothyroidism symptoms.
From a Chinese perspective, how would you describe this imbalance?
So there are a few different patterns in Chinese medicine. A lot of times at the very base level, there is some sort of spleen qi deficiency. We see that a lot, but it usually is in conjunction with a couple other patterns as well. So spleen and kidney yang deficiency is a really popular one. This one I see a lot of times in patients that have really cold presenting symptoms, especially like all their limbs are cold. They are just that person who always needs to be wearing a sweatshirt. And then you can also have liver qi stagnation with phlegm nodules. This one I see a lot with the goiter patients. And it just happens to be that a lot of the time when I do see the goiter patients, they have a lot of stress in their life.
For goiters, is it usually hypo or hyper?
It can be either.
It can be either?
Yeah, it can be either. So that's what makes it confusing. You have to look at all the other symptoms. But I do find that those people have either things that they haven't expressed or they have a lot of resentment. There's usually, not that it's one for one and that always goes together, but I tend to see that when there's some sort of what we would call phlegm in Chinese medicine, and it's right in this area. It tends to go with not speaking your mind, holding on to stress, a lot of mental, emotional things going on as well. Yeah. And then you can also have phlegm stasis and blood stagnation. So this is a little more severe, and the nodules in this case might be almost like matted down. They're hard, So
can people usually feel those nodules?
Yeah. And they're lumpy and they're uncomfortable. You can get coughing from it, but you just feel like something's sitting there because it is. So it's uncomfortable. Yeah.
So what I love about Chinese medicine and what we do here at Healing with Zen, we like to look at the body as a whole, right? And we don't just look at your symptoms, we kind of look at the body as a whole. So from a TCM perspective, how would you view thyroid issues? What are you looking at?
So we have the 5 elements in Chinese medicine, and I'm sure this has gotten more popular over the years, so I'm sure you've seen something about it on like TikTok or Instagram. But we have like this little wheel, and all the different TCM organs in the body have a relationship, and this affects this, and then this one affects this one, and it makes sense to us in our head, but there is that same 5-element structure for thyroid conditions and for that whole system. So in TCM, the wood element here would establish the proper timing of releasing all of these different hormones into the body, especially TSH. And then fire, we have activates the appropriate responses within the body. The earth element provides all that nourishment, so that's all the gut stuff. health. And then you have metal, which maintains that consistent rhythm. You can think of that as like your circadian rhythm. And then you have the water element, which is storing and providing all of the basic nutrients. And it's also kind of like your gene pool that you have. So we have all of those elements going on in our head.
Mm-hmm. And on top of that, we look at the body, we look at how the body is functioning overall, right? We're looking at how's your digestion? Are you eliminating your bowels every day? How's your energy levels? How are your circulation and sleep and all of that too, right? We look at the mental state of the person. So we're not just treating nodules or just your exhaustion. There's a lot of things that we're looking at to balance you out. So let's talk about that then. So let's talk about when somebody is diagnosed with Hashimoto's or hypothyroid symptoms, what does treatment typically look like?
So from a TCM perspective, we usually will do acupuncture and herbs. At least I like to. I find that these patients usually need a little bit more help in between appointments, and most people can't get acupuncture every day, unfortunately. So acupuncture minimum once a week. Usually I see people twice or more if doable. And then custom herbal formula that carries them between those treatments. And then I also really like ear seeds. So I don't know if that's part of other people's treatment, but I really think they're good to have. And I know a lot of patients really like them for releasing stress, because having a condition like this, especially if you have the diagnosable name attached to it, it can bring a lot of stress because it feels like something out of your control, even though it's not.
And so for those of you who don't know, ear seeds are essentially little beads or stickers that we put in acupressure points in your ear. And they can take it home in between their treatments and massage and work on them and release some of that stress that Kira was talking about. You also mentioned custom herbs. So can you talk a little bit about that?
Yeah, so custom herbs are great because they're custom to you. We can decide based on your current pattern, and by current we mean like that day and the surrounding weeks. We can look and see, okay, we can remove this herb, we can lower this dosage, we can add this one in, and then the next time we see you, which would be in, the next week or whatever, we check that again. And then when you have to refill after about 2-ish weeks, we don't just give you the same exact formula. We look to see how you're presenting at that time again and try to always course correct. So it's not just a one size fits all. Like every Hashimoto's patient gets this formula. Every hypothyroid gets this formula. It's very much based on you. And
I love that approach too. And like you said, because our hormones are always changing, different times of the cycle, we might even change your formula just to make sure that those flare-ups don't happen too. So it's a great approach. And for people who don't know how to take herbs, the old way of taking herbs is we take all the twigs and the leaves and the root and we cook it in a soup and we drink it every day. But we don't make our patients do that. We work with a herbal supplier that has already cooked it all together for you, and it's dehydrated into a powder. So it's actually really easy for you to take. It comes in a little bottle with a spoon, and then Dr. Kira will let you know how many spoons to take every time. You're going to mix it with a little bit of hot water and just drink it like a tea. So you still get the whole experience of the taste of all the herbs and what it feels like, but you don't have to cook it yourself. So we have lots of solutions for that.
Yes, definitely.
Okay, so when you mention estrogen dominance, what key factors might play into that?
Yeah, so sometimes it does just come with, if you have a diagnosable condition in terms of your menstruation, that's a separate thing. But also a lot of us these days tend to be a little bit estrogen dominant because of all of the environmental toxins that are out there, not to scare people, but just to be aware that they exist and they very much have a direct effect on our health. And so there's a lot of xenoestrogens out there in terms of like herbicides, pesticides, that sort of thing. Also with higher body fat percentages, that tends to also increase estrogen, chronic stress. So there's a relationship between estrogen and cortisol. There's a lot of different relationships between all the hormones in the body. And a lot of times, like if one thing is way too high, the other thing is going to be acting weird. So we got to get everything in balance. Also, if your liver cannot detox properly, so if your liver is not having the right nutrients for its detox pathways, then you're not metabolizing estrogen and it's sticking around in your body much longer than it needs to. Also with diet, fiber, as we know, is a great way to detox estrogen. It pulls it out of the bowels. So like she said, make sure you're having the bowel movement, make sure there's a lot of fiber in your diet and it's pulling out all the things you don't want stuck in your body. And contraception too is an obvious one, but that's a very personal choice, but that exists too, and that's...
Are there common signs of estrogen dominance?
Usually it almost overlaps with hypothyroidism. Like there's
So the fatigue and the
all
of that?
Bigger bodies, you tend to not be able to lose weight as quickly, or you hold on to weight, you hold on to water weight, there's swelling.
Okay, Dr. Kira, so what are your top 5 tips for Hashimoto's or hypothyroid patients?
Okay, so first one would be definitely make sure that either your iodine is being tested if you're getting that thyroid panel, or you're doing a iodine loading test just to see, especially if you are the autoimmune Hashimoto's presenting type of hypothyroidism. That's really when it matters most. Just make sure that that iodine level is optimal, but not too much. Also, make sure that, again, you're not just testing TSH, but you're testing free T3, reverse T3, T4, TPO antibodies. If you feel like you do have the Hashimoto's form, you want to get the full panel. And I know some doctors will just do TSH. So if that is the case and you hear that, just please ask for an entire thyroid panel. Also, your microbiome is crucial. If you have leaky gut and you have things from your food and your drink and the air that are getting into your bloodstream, and then your body is seeing that as an attack on itself, then that's causing a whole slew of other symptoms. And especially if you have an autoimmune condition or you have hypothyroidism in general, you don't need the extra stress on your digestive system. It's already slower, so you don't need to have something else taxing it as well. So eating properly is crucial, and for women, please eat protein and please eat in the morning. Don't raise your blood sugar at, the middle of the day when you have your first meal. So a high protein breakfast, please. And then also cortisol, like we talked about, that can initiate reverse T3. So basically it's just putting away good hormone that you have, and it's not doing anything. So stress levels are crucial, and that's why acupuncture is so great. Acupuncture is fantastic for reducing cortisol and your stress response. So that's one easy way, and you basically get a free meditation out of it because it almost like forces you into a meditation when you're laying there. So that's the easiest way that I've found to get myself to a very calm state, and it lasts for days and days, if not weeks after the treatment. And then if you have any sort of irregular or heavy period, test to see where you're at with your estrogen levels. If they are increased, we talked about how estrogen has that relationship with the thyroid and how it can affect your thyroid hormones and their levels. So your period can tell you a lot. That is a question we always ask when we first see people, is about their periods and if they're heavy, if they're coming, if they're not coming, if they're painful, all the questions. And that just alerts us to the fact that maybe your hormones are not in the right balance, and that can affect your thyroid as well. So those are my tips.
Those are great tips. Thank you so much, Dr. Kira. Well, thank you so much, Dr. Kira, for all those wonderful tips. If you or anybody you know is suffering from thyroid issues, please reach out to see if we could be of assistance. Once again, my name is Zen Tuan, licensed acupuncturist, herbalist, and founder of Healing with Zen. Thank you so much for your time, and we hope to see you in the next episode. Bye.